Hey, this is Nicholas. Let's talk about how to talk to your patients and specifically how to explain acupuncture needles to your patients. So this is one of those things that's just really easy to overlook, especially when you're first starting out in the clinic. You get so caught up in asking questions, filling out your paperwork, coming up with a diagnosis, choosing your points, that you forget that you actually need to talk to the patient and explain to them what's going on. And this is an important skill, being able to communicate with your patient. When you can clearly and concisely explain to them what's going on, then they'll be more confident in your treatment, they're more likely to come back, and they're more likely to tell their friends and refer them to you. So just to give you an example, this is how I explain acupuncture needles to my new patients. So first, I like to ask the patient, would you like a demonstration? Some people don't care and want to just get right to it. Some people are afraid of needles and seeing a demonstration puts them at ease. Some people are afraid of needles and seeing the needles just kind of freaks them out even more. So I like to ask first, but I would say the majority of people are curious and say yes. So this is what I tell them. These are the needles we use. They come individually wrapped. They're made of surgical grade stainless steel. They've been sterilized in ethylene oxide gas. They're single-use disposable, so I use them once and then throw them away. The needles themselves are actually quite thin. I don't know if you can even see that. These are like 0.2 millimeters in diameter, so it's a lot different than getting an injection or an IV. The way it works is each needle comes with a tube, and as you can see, the needle is slightly longer than the tube, and that lets me just boop, tap it in. As it turns out, all of your sensation is on the surface of the skin, so you might feel a small pinch as the needle breaks the surface, but after that, you don't really feel a whole lot. So if I wanted to, I could place the needle deeper, and that's about it. Now, things you might feel. You may feel a dull ache, you may feel a heavy sensation, you may feel a warm spreading sensation, or you may feel nothing at all. Those are all good. If you feel anything uncomfortable, like a sharp pain, a burning sensation, or an electrical shooting sensation, let me know and we can adjust it. So the point is, this is supposed to be a relaxing situation. Once the needles are in, we usually let you rest for about 15-20 minutes, and during that time, most people fall asleep. So this is supposed to be something that's relaxing, not I have needles in me. So if there's anything that's uncomfortable, just let me know and we can make some adjustments. So after about 15 minutes, we take the needles out, and they're so small, they usually don't bleed, and then we just throw them away. So with this explanation, I'm trying to accomplish a few different things. Number one, I'm telling the patients up front that the needles are clean, sterile, and disposable. Believe it or not, I have had a few people ask about this, so it's good to just put their mind at ease right at the beginning. Number two, I'm telling the patient what to expect in terms of physical sensation, and then inviting them to check in with me if anything's uncomfortable. Some patients, especially if it's their first time, they might think that if it hurts, they're just supposed to put up with it. And that's not really what we want. And I'm also letting them know that we usually retain the needles for 15 to 20 minutes. This is something that, if you've been doing this for a while, it's easy to forget that most people just don't know. Either they've never had acupuncture before, or they've only had dry needling, and so they don't realize that we leave the needles in for a while. So overall, this just gives the patient an idea of what to expect, and that makes them feel more confident and more relaxed on the table. It also gives them something that they can take with them and tell their friends. So when their friend is like, "Oh, you got acupuncture? What was that like?" And then the patient will say, "Oh yeah, it was really great. The needles are so thin, they use a tube to tap it in, and I was so relaxed and blah, blah, blah." Because, that's how my patients talk. So this is just one example of how to talk to your patients. You almost want to have a script for common questions that you can just rattle off. That way, you can sound intelligent and professional instead of having to your whole way through it. So this applies to other things. Like, what are the needles doing? How does acupuncture really work? How long is it going to take to get better? What kind of results should I expect? How often should I come back? Or, if you need your patient to disrobe, how do you tell them in a professional, comfortable way? Take off your clothes and get naked. How do you explain cupping? How do you explain herbs and why they should take them? If a patient doesn't feel any better after the first treatment, what do you tell them? Or, if the patient actually feels worse after their first treatment, what do you say to them? So these are some things to think about, and sometimes it's good to have an answer prepared in your head so you know what you want to say when the question comes up. So let's turn it over to you. How do you explain needles to your patients? Or, what common questions come up during a treatment that you have a pre-made response for? Let us know in the comments below. And remember, some of the best tips come from you. So that's all for today. Hope you enjoyed it. If we haven't met, my name is Nicholas. I make study videos about acupuncture and Chinese herbs, but in this series, we're talking about things that commonly come up in the student clinic. So if that's something you're interested in, consider subscribing, and we'll see you next time.